Lyme disease is born by ticks and becoming more common throughout the world. It is spread through the bite of the black-legged or deer ticks and is caused by the spirochete bacterium Borrelia burgdorferi and Borrelia mayoni. Lyme is also the most common American disease that is carried by a vector and is also the most common in Europe. There are 3 stages of Lyme disease: early and localized or early disseminated, where up to 70% can be cured using antibiotics, and the target rash occurs in less than 50% of cases. There is also late disseminated or chronic Lyme disease. It can take months or years to achieve remission, and it can flare up. Researchers are not clear if complete removal of Lyme's can ever be achieved, but the goal is to reduce bacterial load so the immune system can keep up. Signs and symptoms of Lyme disease can vary and can include rash at the site of the bite, itching, headache, fatigue, fever, muscle aches, paralysis of the face, syncope, heart complications, hot, swollen, and painful joints, and depression and dementia are long-term complications. The incidence of contracting Lyme disease is inconsistent. There is inconsistencies in reporting and diagnosis, so it's hard to know exactly how many people each year contract it, but it's estimated that approximately 300,000 people in the U.S. contract it each year. If a tick bite does occur, it is less likely to get Lyme if the tick is removed within 24 hours. The visuals from the Center of Disease Control show the Lyme disease cases distributed across the United States in 2001 versus 2005. They haven't done a recent update, however, we can see as of 2015, the incidence has approximately doubled in the Michigan, Great Lakes area and New York and Pennsylvania areas. Companion vector-borne diseases provided this global map of Lyme disease. Per this map, only Australia and likely Antarctica is free of Lyme. Every other continent in the world has Lyme. Europe has the widest spread of the illness, followed closely by the United States and Asia. People who contract Lyme disease are anyone who spends time outdoors in at-risk areas without taking precautions or who miss a tick that has attached itself to them. Lyme disease is most commonly found in the Northeast and Upper Midwest regions. Infected ticks are also found in neighboring states as well as Oregon, Washington, and Northern California. In 2013, Lyme disease began becoming more well known. Public Health England lab reports show the diagnosis had increased fourfold since 2001. The population has increased and humans enjoy outdoor activities and forget to follow recommendations such as sunscreen and insect repellent. Another reason for the sudden increase is public seeking diagnosis. Big-name celebrities like Avril Lavigne and Shania Twain are 2 of these. Socially, this prompts the public to be aware of Lyme disease and to be more likely to ask for testing.
Like literally the top doctors. And they were just like, they would so stupid. They would pull up their computer and be like, chronic fatigue syndrome. Or why don't you try to get out of bed, Avril, and just go play the piano. It's like, are you depressed? This is what they do to a lot of people that have Lyme disease. They don't have an answer for them.
As we saw with Avril, another issue with Lyme disease is that it can be hard to identify. A search brings up others whose Lyme went undiagnosed for months and years. Unlike Avril, they didn't have the top doctors, but they were also told that they were just depressed and needed a new hobby. The virulence of Lyme disease changes as a tick nymph grows and feeds. The spirochetes show a lack of quantity to cause infection in humans when the nymph hasn't fed on blood. After feeding on blood, the spirochete multiplies into infectious quantities, which increases the risk of contracting Lyme disease when bitten. Lyme is not yet fully understood, but it is believed that it is not deadly on its own. However, the spirochete can cause long-term complication to the heart, muscles, and nerves. I mentioned Shania Twain, who can now no longer sing for fun or spontaneously because the Lyme has caused permanent atrophy of her vocal cords. She can still sing, but she must warm up for an hour and a half before she can sing, and she can't sing for long stretches of time. Another more deadly complication is the heart. The heart muscles can atrophy or become inflamed. At times, this will resolve on its own with the antibiotics, but examination of organ donors who have died suddenly have had damage to their hearts and the presence of the spirochete has been found. Anyone who spends any time in an outdoor environment where ticks live are at risk of contracting Lyme disease. There's no discrimination on age or blood type. We must learn to treat Lyme disease better. Currently, the diagnosis of Lyme is made by signs and symptoms, history of possible tick exposure, and laboratory tests. Lyme is verified first by either the enzyme immunoassay or the indirect immunofluorescence assay. When a positive is found, a Western blot is run, a positive being confirmation. Some literature is noting that these tests may not be definitive. In the early stages of treatment, oral antibiotics are required. Some patients with neurological or cardiac symptoms require IV drugs. Chronic Lyme disease is under research, but the National Institute of Allergy and Infectious Diseases believe that antibiotics are not useful and only cause a placebo effect. They are continuing to research what treatments are the most helpful for chronic. To prevent Lyme disease, you must wear a repellent with at least 20% DEET. Treat clothing with permethrin. Wear closed-toed shoes, long sleeves, hat, long pants tucked into socks, and white or light clothing. Avoid wooded, brushy, and leaf litter strewn areas. Check for ticks daily, and if you live in an infested area or venture into a danger zone, check everywhere, including belly buttons, elbows, knees. Shower after returning inside. Wash your clothes on hot and dry them until they're completely dry and warm. Remove ticks immediately and keep in a Ziploc bag to have tested if any signs or symptoms develop. And seek early treatment. Our role is to advocate for our patients. We must take their symptoms seriously. Look for underlying factors and treatments to assist them. Advocate for continued research to better understand the diagnosis, symptoms, and treatment of Lyme disease. Advocate for more research on chronic Lyme and long-term side effects. Finally, don't assume that because they haven't been in a Lyme-affected area that they haven't contracted it. That is my presentation. Thank you for listening.